The broad objective of WACIT is to improve the mental health of vulnerable children across the world, irrespective of the support system and resources in different countries. So working with different partners, we have established levels of capacity building and generation of evidence through research projects. Looking back, it's difficult to believe how it all started because we had no money, no structure, and no access to vulnerable groups and communities. But it was the passion of our partners and the response of the communities that carried us on the crest of the wave.
Kenya yetu hakuna matata. Jambo, jambo wana, habari gani? Nzuri sana. Wageni wakaribishwa, Kenya yetu hakuna matata.
This early experience and evidence gave us the belief to move on to the second phase. This involved the establishment of networks on the ground, the development and implementation of interdisciplinary training. The aim of the training was to enhance the psychosocial skills of community volunteers, caregivers, and frontline professionals.
Değdi saçlarıma bahar küleği, nazende sevdiğim yadıma düştü. Her erin bahtına bir güzel düşer. Sen de tek benim yadıma düştün, nazen de sevdiğim yadıma düştün. Sen de tek benim yadıma.
But what was missing was the central part of the puzzle. What were children and youth thinking? So we set out to find out and capture their voices. But of course, the ultimate challenge was to bring systemic changes. For this reason, we put all the pieces together and developed service transformation.
Jerusalema ikayalami ilondoloze uhambe nami zungangishilana. Jerusalema ikayalami ilondoloze uhambe nami zungangishilana dawo yami ayikholana buso wami awukholana ilondoloze
Hi, I'm Juliana from Brazil, from Rio de Janeiro, and I'm here to tell you 2 things we learned during the 16 years working with kids and adolescents around Brazil. They are really resilient, they are really creative, and they are really finding strategies. We have to motivate them. Thank you. Bye.
This is Sajida, Director of the Child and Adolescent Development Program under Hussaini Foundation. And after working with vulnerable children all over Pakistan for the last 12 years, what we have learned is that these children are the most bright, most talented, most creative. Once we reach out to these children, they're the most motivated, the most resilient. All they need is somebody to understand them and support them according to their needs. But before anybody tries to reach out to them, it is very important to get proper training and proper evidence based interventions to be able to support the children according to their needs.
From my research, I found out the following. 1, sustainable interventions which are cost effective and culturally appropriate are required to help these children. In the process of these interventions, it was very clear that stakeholders, where children are inclusive, must be involved in the whole process. That is, in designing, implementation, and evaluation of these interventions. And for this to work best, if all these factors are taken into consideration, then chances of success of these interventions will be experienced.
Hello everybody, this is Şeyda from Konya, Turkey. What I've learned from my experiences of NGO work and the WACIT training over the years is that it's important to know the impact of trauma on the mental health of young people, to be able to detect the signs of problems and to help them. And the most effective way of helping young people at risk is to mobilize everybody around them, including parents, peers, teachers, and community members. Thank you.
A growing body of resilience research in South Africa and our own work at the Child and Youth Care Center, we have found that in spite of these many adversities, our children, and in fact many other children in South Africa, are able to adapt, resist, and thrive. Our work highlights the agency and resourcefulness of youth. We know, however, that children and youth are able to do so much more within supportive context, and our work has shown us that even one meaningful supportive relationship makes a massive difference. Based on this, we believe that the social ecology is instrumental in the resilience and well-being of children. Resources need to be made available and accessible, and importantly, the conditions that give rise to adversity need to be addressed. Thank you.